Hey everybody, welcome to the Home Care Forum podcast with your hosts, Sasha, Guillaume, and Emina Poricanin. The budget's out, is that right? Is that what we're hearing? Or
They're
very close
finishing
to?
it. It's not like fine. No, the budget's out. It's the legislative session
Right.
finishing for the summer. Yes. So one of the houses is done. The other one is not. I think the Senate is done as far as I heard this morning. I'm getting them mixed up, but not quite done. Should be done any moment, and we're still tr waiting for the ink to dry to see if there's anything particularly newsworthy for home care. Do you know like what's big in home care or not
Let's get
yet?
into, I have a few topics of what's happening during the week. Gustavo Rivera did have a press conference this morning with
Okay.
James Skoufis,
Yeah.
where they announced they're going to have an investigating hearing July 9th for the CPAP RFO, that whole process. They discussed their challenges, that they're challenging the governor's decision to move forward with the single FI. They want to do an assessment of the contract award process, the transition process, in order to understand what worked, what didn't work, and also to as an opportunity for lessons learned. As soon as I heard that, I was like, okay, this is just again for show. This is
Yeah.
nothing's going to come from this because in a response to a report or asking about leading age, which will be included in the investigation or in the inquiries, at the end they said that the testimony will inform what they do moving forward, right? So it's not, there's nothing that's going to happen this year. That's done. And there's no guarantee that it's going to reintroduce the bill, which he admitted was gone, right? So the bill, Gustavo Rivera's bill that called for changes in the CDPAP process, that's done out, and there's no promise that it's going to come back next year.
That's very interesting. I agree with you. It is for show. Very disappointing that this issue seems to be dying down even in the legislative pockets of Albany. Somewhat of a related topic, but as we discussed this morning, the budget that came out in April, and the dust is still settling on that. But the budget includes a provision granting the governor, through the Division of Budget, emergency authority to cut up to 2 billion in funding if state revenues fall short or if spending exceeds projections. Like we've been discussing, this is in response to what is happening at the federal level. So the governor closed the budget in April. However, there's a possibility, very much depending on what happens at the federal level, that the state will have to make adjustments. So whatever they have now budgeted and allocated into the different departments may have to be revisited. This is significant leeway where she can adjust the budget mid-year due to economic downturns. The key provision enables the budget to reduce appropriations if more than 2 billion in state revenue is lost. So obviously the state is monitoring all of that to see if it is triggered. We're already 2 months after the budget passed. The feds are still talking about their big, beautiful bill. Obviously, we're on the brink of World War III, so that's occupying everybody's minds as well a little bit. You know, people continue being deported. Obviously, they're all killers and murderers and rapists, and then like just wonderful things are happening all around. Um, One piece of news, as I transition now to the next piece of news, is that the union, SEIU 1199, has finally fessed up that the enhanced KeyVAP is not in this year's budget. So the SEIU 1199 agencies for a few years now have been getting an additional KeyVAP award, millions and millions of dollars, so that their aides can get the benefit of the $1.55 minimum wage increase while not having to pay anything extra for their health insurance. That health insurance premium that the home health aides working for 1199 agencies has fluctuated between $2.20 and $2.30 per hour for years now. When the minimum wage went up and the wage parity contribution got adjusted, the union was faced with possibly having to lose those health fund contributions. And so, in order to preserve the same level of contributions by employees while giving them the benefit of the minimum wage increase and not having to deal with a wage parity decrease, the union sought and got New Yorkers, New York taxpayers to pay for that health insurance. And that was in the form of enhanced KEVAP. So enhanced KEVAP was going into the health fund, the union's health fund. And as we know, only two-thirds of the home health aides at most use that health benefit. It continues to struggle. Even with just a third of people using it, it needs 120 something million dollars to stay solvent after 2025 or 2026. I'm not sure how the union's actually going to figure that out, but they have admitted and acknowledged that that money is no longer available. So the 1199 agencies will now be allowed to contribute a lot less to the health fund, which is good news. The regular KEVAP that had been paid since 2012, that was in addition to the enhanced KEVAP, will continue to flow down to the agencies. And so, as we talked about a few podcasts ago, most of the agency owners rely on that regular KEVAP for their profit. The revenue is just the margins are getting smaller and smaller, and so that KEVAP award is really where what's driving any profit for a lot of agencies. A lot of agencies meaning the few that get this KEVAP award to begin with. So that's an interesting and a significant development for those agencies. Obviously, we have to rewrite these contracts now with SEIU 1199 to reflect this new point. Sasha?
All right, I don't really know how to take that because we're not a KEVAP recipient, so it's good that they're isolating this extra batch of money that not everybody in the industry gets. I hope that if push comes to shove, that they wipe it out completely, right? It's if it's something that goes to specific agencies and not to the industry as a whole, then that should be targeted first. I do want to double back and maybe go a little full circle on the big beautiful bill, and the reason being, or specifically on the hospital, the money that they're going to lose, right? And the reason why I think it's a important thing to point out is because the state always finds money to plug up the hospitals. So if New York is anticipating this shortfall, and the governor has this authority, but they have a history of saving the hospitals. Let's add a little bit more to that shortfall because New York State is looking at a $7 billion a year shortfall under the big ugly bill, right? Which is up from previously anticipated $1.3 million, right? And that was a lot of that's going to come from elimination of the Essential Plan, which covers low-income residents who don't qualify for Medicaid, 725,000 of which are legal immigrants at a cost of 2.7, right? So we are just talking about legal immigrants at this point, right? Now, where the undocumented could be impacted is the Medicaid funding to hospitals, which could be upwards of $1.6 billion in cuts. So it's Medicaid funding for both documented and undocumented, but as we know, a lot of undocumented go to the hospitals, and then therefore this $1.6 billion would help with the funding for those services. Next, on federal level, I wanted to talk about, and I'll throw it to you, Emina, if you wanted to jump in, is the GOP Medicaid reform that's happening in the Senate, which and the impacts to long-term care, which institutes work requirements for able-bodied adults without dependents, right? They must work, study, volunteer, or be in a training program for at least 20 hours a week in order to receive Medicaid. Most people are working, and or differently able people are the ones who are being able to take advantage of Medicaid or a large part of it. So again, these are just words on paper. It doesn't mean anything, doesn't change anything. So you could say there aren't going to be cuts other than the fact that it bars undocumented from Medicaid. Now, if they expand what the undocumented means, or they include the family in that and take away the birthright citizenship, because the undocumented get benefits via their children who are born here and have status. And it's just, for the most part, it's money that goes towards the kids, right? For their food support for the kids. The housing support, you're not going to house the kids without the parents, so there's money there that can be targeted. But again, if you take away the birthright citizenship and are deporting, I guess you can find savings there, right? A big item also is it bars people with $1 million in home assets for Medicaid, right? That was recently increased, and a lot of people use the Medicaid trust and those financial vehicles to qualify for Medicaid. I think it's a good thing, but then we're in New York, state where a lot of homes are $1 million homes. So I think, depending on which state you're in, it's good and bad. Next, we want to talk about the increased eligibility checks to enforce your access to long-term care. So the qualifications and the diagnosis that you need is likely to change. We don't have any details there. These are broad strokes of the bill. So they're going to repeal regulations viewed as burdensome or fiscally irresponsible for nursing homes, where under the Biden administration, they instituted this uniform staffing rules for nursing homes, having staffing levels, nurses per patient counts. It just seems to make sense. But there are nursing shortages and what have you. So, I guess deregulation is the thing here, and it's showing up as decreasing these quote unquote burdensome requirements. Overall goal of this is to slow down the growth of Medicaid over the next 10 years. And they're citing the growth since 2008 of over 207%. So that's what's we're anticipating at the federal level. Okay, next, we have a couple other items left. The U.S. Equal Employment Opportunity Commission. We kind of talked about this during the week. I mean, where the portal for data collection is open, or has been open since May 20th. And the EEOC collects information or workforce data from employers with 100 plus employees. A little thresholds are for contractors or contracted companies of the federal government, but employers meeting these requirements are legally obliged to provide data. Data is used for a variety of items, where it's for enforcement, self-assessment by the employers, and for research data. Each of the reports collects data about sexual orientation, race, ethnicity, and other types of groupings. The data is confidential, but the aggregated data would be available to the public, again, for study research, for news, or what have you. The deadline for this is June 24th, 2025.
Yeah, I want to jump in. So this is nothing new. This is an annual requirement that companies with 100 and more W-2 employees need to participate in. Having said that, there have been changes to what data needs to be reported, as the definition of protected categories has changed, right? Under the Democratic administrations, the sexual orientation, gender-based classes play a lot more prominence in these types of reportings than perhaps under Republican administrations. Across all administrations, the fact is that the EEOC does not have a regulatory mechanism built in to penalize those employers who don't participate. So yes, this is a requirement, but is there actually a stick to the carrot or carrot to the stick? No, there isn't. And so employers who choose not to report this can kind of take some risk, but the likelihood of them being caught or penalized or somehow disciplined for not participating is elusive. What Sasha mentioned also bears some emphasis. There are entities who contract with the federal government. They are either direct contractors or they are contractors to those government contractors, i.e., subcontractors. And they have obligations and more of a consequence if they do not participate in these EEO1 reporting requirements. So if you are not a federal contractor or subcontractor, some of the pressure to report and participate is off.
Okay, next, this week we saw the implementation of the new or revisions to the weekly COVID report on June 10th. Department of Health had a webinar announcing this. The process was effective June 17th. The new requirements just calls for county level census reporting of your patient count, right? I think this is more of an issue with the EMRs that the data is not great, but you should be able to hopefully plug in and pull that data. If you have a license that has multiple counties and you don't have any patients in a specific county, you are to enter 0. Don't leave it blank. Add it to the report and just put a 0 there. Again, open on Tuesday at 8 a.m., closes Thursday at 2 p.m. And you need to make sure that some of the patients across the counties matches the total number that you put at the top of the form. If there are discrepancies, it will trigger a quality committee review and may require follow-up by DOH. This applies to all LHCSAs, regardless of the service area. If you are servicing in a nursing home or assisted living program, you are still required to submit this, and only one submission per license is allowed. No updates or revisions. I'm going to put a pin in that because I believe I saw an email from the Department of Health that said that they would allow revisions, but their first announcement was that no revisions, so make sure the data is accurate.
The other major news this week that has really made everybody wonder and quiver about their reimbursement rates is the announcement that Elder Plan and Village Care are merging. It is supposedly the merger of equals. We have no idea what that means, but to be clear, no one's rate with either company is safe. New rates will be established. The merger is expected to be finalized next year. The fact that the announcement was made already suggests that they are pretty far in that transaction. The thought is that it is being done largely at the behest of Village Care because they have made some poor acquisitions. We will not name anybody, but supposedly they have made some poor acquisitions in the past and they are really struggling. And so even though it is being presented as a merger of equals, it seems from what we're hearing is that the merger is at the suggestion of Village Care because of the rates and the commitments that they have overcommitted and made to providers.
That's interesting. I mean, I thought Village Care was positioned themselves to sell to a national player, which is not unlikely because I think that's what New York State is going to be managed by. Managed care will be by these national players. So we will wait and see. Last thing, minor item is that the 2025-2026 budget includes an increase in the jury duty daily payment from up to $72. That's from $40 per day. I don't know any employer that asked for that reimbursement back. Emina, I don't know if
No, I don't know either.
Okay, well, I don't think so either. But just as a FYI, that is it for us this week. This has been the Home Care Forum podcast with your hosts, Sasha, Guillaume, and Emina Poricanin. Have a good one.